The purpose of this video is to show the process for collecting blood culture specimens and inoculating BACTALERT blood culture bottles using the syringe draw method. At the end of this video, you should be able to collect and inoculate blood culture bottles using the syringe draw procedure. Required materials: BACTALERT bottles. All bottles will have fill level markings. Certain bottles will have a fill to mark. Chlorhexidine gluconate prep, or equivalent to clean the venipuncture site. Tourniquet. Alcohol prep pads. Syringe and safety needle. Gloves. Transfer device. Sterile gauze. Band-aid or bandage and tape. Specimen transport bag. And marker if required based on bottle type. Have all of the necessary supplies within easy reach. Identify the patient according to your facility's policy. Select the venipuncture site. Clean the selected venipuncture site as recommended by your facility's approved procedure. Do not repalpate the vein. Allow to air dry. Inspect the BACTALERT bottles for cracks or contamination. The sensor should be a blue-green color. If yellow, do not use. Check the expiration date on the bottle. If expired, do not use. Unless the bottle has a fill to mark, mark the maximum fill volumes from the fluid line. Adult is 10 milliliters, pediatric 4 milliliters, using the pre-marked increments on the bottles. Remove the plastic flip top and clean the septum with 70% alcohol or equivalent. Allow to air dry. The plastic flip top is to protect the septum only and does not make the septum sterile. Assemble the syringe and safety needle device. Perform the venipuncture and aspirate 10 milliliters for each adult bottle and 4 milliliters for the pediatric bottle. Aspirate additional blood if other testing is required. When the amount of blood required for all testing has been aspirated, remove the tourniquet. Terminate the venipuncture by placing a piece of gauze over the puncture site and withdrawing the needle from the vein. Activate the safety device and detach the needle from the syringe. Discard the needle into a sharps container. Attach the safety transfer device to the syringe. Inoculate the anaerobic bottle first, and then the aerobic bottle. Blood flow will not stop at 10 milliliters, 4 milliliters for pediatric. Keep an eye on the level to prevent overfilling or underfilling a bottle. If vacuum tubes are to be filled, insert the adapter insert if required, and fill the tubes in recommended order of draw. When inserting the adapter, hold by the outer lip. Do not place fingers in the hole to prevent finger stick with the needle. When the final tube is filled, discard the transfer device and syringe into a sharps container. Remember, the whole adapter cap, insert, and syringe goes into the sharps container. Invert BACTALERT bottles 3 to 5 times. Label the bottles according to your facility's policy. Avoid placing labels completely over the bottle barcode or on the bottle sensor. Bandage the patient when bleeding has stopped. Place bottles and tubes into a biohazard bag and transport to the lab as soon as possible and according to your facility's policy. In summary, to collect blood cultures using the syringe draw method, have all the necessary supplies within easy reach. Identify the patient. Select and clean the venipuncture site. Inspect bottles. Mark the fill volumes and remove the flip top and clean the septum. Assemble the syringe and safety needle device. Perform the venipuncture. Aspirate the appropriate amount of blood. Place a gauze over the puncture site and withdraw the needle from the vein. Activate the safety device. Remove the needle from the syringe and discard it into a sharps container. Attach the safety transfer device to the syringe. Inoculate the anaerobic bottle first, then the aerobic, and finally any additional tubes if required. Discard the transfer device and syringe into a sharps container. Invert the bottles 3 to 5 times. Label with patient information. Bandage patient arm. Place bottles and tubes into a biohazard bag and transport to the lab.